Maverick Physical Therapy, a little TZ1B and a little TZ1C dowel work to get a little bit extra nerdy with the dialogue, the thoughts behind our strategies and techniques. Look at the previous versions in terms of TZ1B and C. So TZ1B positioning, I'm not going to re-highlight in terms of the biomechanics of everything. I'm going to take you through what you need to do. So TZ1B, glove side, hand down. Typically go with baseball and glove side and feet kind of perpendicular. So it's, for me, right-handed pitcher, it's this left lateral lunge in which this left foot has opened up, but it's in an I position, meaning kind of internally rotated a little bit. And so I will use these dowel progressions as a means and as a way to further improve feedback, further improve mobility. It's a great self-mob technique and tool that post the active mobility, warm-up related stuff that I'll take you through. We need to jam into this right away before you even throw a baseball. You have to. So a little TZ1B. So I'm driving kind of the hips on forward, left arm with the dowel. It's kind of driving almost like a little lever arm. I always think about Polar Express, kind of driving a train, old school train, using the big old lever arms and systems. So a couple things that I'll do here to tweak this. If I want to go after a little more thoracic spine, my nose, head, and eyes are going to go with my throwing arm and in the direction of my glove side arm. If I want to mob the C-spine as well, I'm going to fixate on a forward location. That would be like focusing on my target. So I'm going to go after thoracic spine a little bit more. And I'll go with a little progressive oscillation at end range, using this glove side arm on the dowel to really help facilitate some right rotation, my head, nose, and eyes. By going back with my arm as well. Now if I want to go after a little more C-spine, I'm going to focus on a target and drive, because as I'm getting right rotation of the thoracic spine, getting left rotation of the cervical spine, and as we talked in previous episodes, that's going to have a big effect upon how the thoracic spine, scapulothoracic joint, and hips are functioning as well. TZ1B, I'll show you that from a little bit of a different perspective here. So TZ1B, play around with the position of the dowel. I'll typically go midline and back a little bit further with the arm. So here I am with the right rotation of the head and a little C-spine. Some things that I can do and like to do with that are the position and the height of the glove side throwing arm, as that plays a pivotal role in terms of the loadability of right scap and right hip. So typically even go a little bit higher and maybe even over exaggerate kind of this right side bend. TZ1C, that's as we transition from 1B towards home plate with that back hip. So the back hip is being unloaded now into external rotation. The pelvis speeds up, passes up the femur towards home plate, giving us extension, external rotation, the abduction of the right hip. So I position the individual, the pitcher, so basically in this almost in the sagittal plane lunge position, with the right foot toed out a little bit, left foot toed in, so almost in this LXI position. I'll still use the dowel, obviously the ball in hand. If no ball in hand, free hand is okay as well. So what this is going to look like is this drive and the shift forward of the hips and this progressive oscillation, and I'll use this glove side arm on the dowel as, again, a way to kind of drive me into some right rotation to further disassociate the trunk from the hips, to further load the scapula, the shoulder complex, as that is a huge pivotal area in which we see a lot of early release, of that rubber side hip, a lot of early release of that throwing side arm and throwing shoulder, in which we have movement from the top down from the throwing arm, so actively trying to do too much rather than that good body on arm mobility and stability that we're looking for. So that good closed kinetic chain-like effect that we get to this mushing, this proximal stability for distal mobility, this proximal stability for this accelerated distal kind of mobility. And so I'll position my 1C, and again, I'll take have him take the right head and turn it, rotate it to the right, excuse me. Right head, we're not talking about monsters, we're talking about humans here, as far as I know, to help kind of further improve the right rotation of the thoracic spine. So we're getting this out of sync type 2. And if I want to go a little more C-spine, that's a little problematic. Fixate on the glove and rock and roll. Different perspective. TZ1C. Show you a little bit of a different angle even here. So here, I'm going to just take my head and my eyes and go with the thoracic spine. I'll reposition this dowel. I'll go a little more C-spine. TZ1C, dowel.